Hello there. Welcome to our episode today on the Medics in Tech podcast. With me today, I have a friend and a colleague in Global Health, Fan Yusuf from Tanzania. And we'll be talking about the intersection of health and technology, his work in Tanzania, things he has done across the continent, his various programs, and his work experience as well as they intersect digital health. So I'll first go with his bio. So Fan is a pharmacist and he has more than 10 years of work experience with public, private, and non-profit sector in Tanzania. His expertise encompasses health, commodity logistics, pharmaceutical supply chains, and public-private partnerships, supporting projects funded by USAID, PEPFAR, BMGF, and yeah, a lot of experience. And yeah, that's very, very impressive. And I think you have so much experience in digital health. You have some work you do in podcasting as well, which you do in partnership with with an organization. So yeah, quite a lot to discuss this episode. Farhan, you've worked extensively with various programs, public, private, partnerships, and healthcare. In your experience, how can you describe the tech companies you work with, how you've been able to effectively collaborate with them as well, and the intersection of government and NGO involvement for healthcare programming in Tanzania?
Firstly, thanks a lot, Gabriel and the Medics in Tech team for having me for this particular podcast session. Digital health is definitely an area of passion, and happy to talk about it. Whenever I can, especially when it comes to its implications on the African continent. So I think, Gabriel, when it comes to, public-private partnership for health, whether it is in digital health or in any other area, but I think maybe more so in digital health because it is something that is a new concept that needs to be, like developed, etc. I think there are many things to keep in mind, especially if you want to create that public-private partnership sort of environment. But I think the three sort of critical things that came to my mind were number one, of course, digital health is a means to an end, right? Like it's not an end. And usually, with many of our public sector entities, our governments, they already have the end in mind. There are a lot of, government strategies, priorities that are already set out, and so it definitely helps if a digital health sort of startup organization, etc., aligns with those priorities and strategies. I think it becomes much more collaborative in that way rather than doing things that may not necessarily align with the government's priorities and strategies. Secondly, I think it is very important for these digital health tech companies, etc., to participate in discussions around the health sector. In my experience of doing work in public-private partnership, one of the things that I've always noticed is that the private sector tends to get very easily frustrated or, just feel like, what's the point of me participating in these meetings, in these discussions, etc. But whenever they have participated, I think I have seen a lot of value come out of it. And that's what we are always telling these entities, that participate in discussions in different technical working groups, in different forums, etc., that are taking place so that you can learn what's happening in the country. You are able to share best practices and basically build a case for whatever it is that you are trying to do, whatever innovative approach that you are trying to bring. It's very important to share those practices in those forums. And then lastly, I think there has to be a sort of conscious effort in using and building local talent in the country, right? I think, sometimes what we have seen happening with some of these, digital health or tech organizations is that there's a lot of talent that may be brought from other countries, etc. While I understand why that happens, building capacity and all can take a lot of time, and finding the right talent within our countries can also be a challenge many a times. But I think there's again a lot of value in putting in the effort to build that talent, and that then helps you also create better relationships with the local organizations, with the government, with the local entities, because you are utilizing local talent that's very aware of the context in that particular country.
So yes, I mean you said a lot there, but to zoom in and bring your experience to bear more, let's discuss about the role of digital solutions in ensuring timely access to essential medicine, so that we can pick a particular aspect and we talk about it. So in discussing availability of medicine now in remote areas, what role do you think digital solutions can play, and how have you been involved in those kind of solutions, and what would be your recommendation or the realities that you've seen? Just speak about that.
So I think, Gabriel, here we are talking more about how I guess digital health can be used to strengthen supply chains, right? Where we are trying to ensure that the commodities are reaching those people who are at the last mile. And I think there's a lot of role, of course, that we have already seen in practice on the African continent, being played by different digital health innovations, etc., in that space. But I think, again, number one, there is supply chains and many aspects within the health sector require data for effective decision making, for timely decision making, for understanding needs, for doing so. For example, if there are health facilities that are near each other, if one gets stocked out and we know and another one has enough stock, how do we sort of facilitate that transfer of commodities between them? So data visibility is extremely important when it comes to supply chains. And I think, one of the best ways to do that, if not the only one, is through the digital health innovations. Like when we use technology, when we use digital systems, we have the kind of real-time data that can allow us to make those kinds of decisions, especially at the last mile, right? Because when you have these far-reaching areas, sometimes getting commodities centrally may be difficult, but if you are able to understand what the situation is in that particular area using data, it becomes much more easier to facilitate things that can rescue situations as far as supply chain is concerned. Of course, when it comes to digital growth and technologies, we are also seeing a lot of new ways of transport come up, which is a big part of supply chain and access. And so we have seen, for example, in many African countries now, I guess, technologies like drones being used to supply medication, right? And so that helps with, again, reaching the last mile, going to some of those hard to reach areas, either because of their already geographic location where they are, or because of things like climate change. We are seeing a lot of challenges right now with weather that we cannot sort of predict, and all of that, floods that are taking place, and that really disrupts supply chains. But having technologies like drones, if you're able to adopt them, would be able to, again, at least help us rescue the situation by sending some key commodities. And then, of course, supply chain is very process oriented. There are a lot of different processes. So, for example, you need to quantify your needs and what amounts of commodities you need. Uh, we have evolved over the years. There was a time when these processes were very paper based. Then we went into logistics management information systems that are electronic, digital, and online. But what we are seeing now is that with emerging technologies like artificial intelligence, we are able to optimize and make those processes even better. And there are startups. So, for example, in Tanzania, we have one called Afya Intelligence that's already doing that, using technologies like artificial intelligence to improve the process of quantification so that we are better able to understand our needs. So there's a lot of different ways that digital health can come into play in increasing access, especially at the last mile.
Thank you so much for that. Another thing that you said that I like is the fact that you mentioned things like drone. You mentioned some things like just being able to manage data. So they look small compared to maybe like AI that is like a new technology, but sometimes it's not how big the innovation is. It's just being able to solve problems. So I think I like the extensiveness of examples you use in describing that. Okay, so let's look into some key projects that are happening across the continent. So we have, okay, and the ones that you've been part of, like USAID project, PEPFAR, and some of these big projects. But I know they're doing a lot. There are a lot of funding, there are a lot of support. I was in Rwanda as well for my MGHD, and I know that there are lots of support. But over the years, we've not really seen huge emergence of some of the investment, some of these programs. So how will you describe the challenges that are on ground? Like, why are these approach is not working so far. What do you
Uh-huh.
think? Because there are lots of investments, right? And there are lots of projects.
Yes, Gabriel. I mean, there's a lot of investment, yes, and there's a lot of sort of discussion around innovation and digital health again and all of that. But I think, one of the challenges where, by the way, a lot of research, resources go in is the challenge around creating an enabling environment, right? Which basically means, do we have the right kind of policies in place? Do we have the right kinds of guidelines and all that in place, right? And that many a times takes a very long period of time. Like when you're talking about, sometimes it feels like developing an innovation is probably quicker than doing the discussions around policy and enabling environment and all of that, because those processes tend to be quite bureaucratic and, a lot of time, a lot of discussions go into that. And so that is definitely something that has been a challenge. I don't know if there's a way that we can make these processes a bit more robust, a bit more dynamic, especially when we live in the fourth industrial revolution right now, where we are talking about, logarithmic change. We are not exponential change, rather, not logarithmic anymore. I think technology is developing way quicker compared to how our policies can keep up. And that's definitely something that we need to think about collectively and see how we can solve that. Otherwise, the policies will always be playing catch up to, some of these innovations, etc. And a lot of investments will be put into, doing or developing use cases and developing prototypes and developing value propositions, etc. But then, which brings me to the next challenge, is that aside from the enabling sort of environment and policies, the other challenge has been sort of financing for adoption and scale, right? Because a lot of these resources that we get are usually for building an idea, starting an idea, like proving a concept, showing a use case, etc. But then once that has been shown, how quickly is something being adopted and scaled at the country level, right? Because I know, for example, there are some innovations that have been piloted for like 1 or 2 years, only for later on governments to be like, no, we don't think this is a really good idea. So you have all of these resources that go into, again, I understand that the health sector is very sensitive and we are always thinking about the well-being of the people. So I'm not saying necessarily every innovation needs to be adopted and scaled. By all means, no. We should be careful about what we are adopting, what we are scaling. But I do think, at least in my experience, and happy to hear from some of the viewers when this podcast comes out as well, what their experience has been. I think there's a lot of promising innovations out there. There's a lot of research that is being done that is not being adopted and scaled, and that becomes a challenge. Of course, the third thing I think is also, which is somehow related to the first two, is that there is just generally, I think, a lack of understanding about technologies, right? Like, especially again, when we're talking about the peri-urban and rural areas of our countries, etc. Do people understand these technologies? Do they know how to use them? Because the voice of the citizens is a big factor when it comes to policies, when it comes to funding, for example, or financing, especially from the public sector. But if that outcry is not coming from the citizens who don't even understand what some of these technologies are, what how does that impact adoption and scale as well? So we need to think about, I think the interplay of these three things: awareness across the levels, uh, how that influences policy making, and how that in turn influences financing, because those three, I think, are very important when it comes to growth of this digital health space on the African continent.
Okay, well, thank you so much. I think we've dwelt a lot on some of the challenges and why this is not working, why that is not working. What are the solutions currently, or what are the things happening at the moment, maybe from Tanzania or on the African continent, digital? I mean, speaking of digital health, what are the promising solutions that you think kind of excites you, that when you look at the future of health in Africa, you can say, okay, because this is happening, or because this is this is going to work. I'm kind of excited for the future of health. What are those things for you?
Well, I mean, I definitely think, if we think about it just from the, sort of space of, prevention, treatment, management, thinking about diseases and how that happens, I think there's a lot of exciting things happening. So, for example, when we talk of prevention, there are so many more innovative ways to share education right now, right? Like when it comes to health education, there are so many innovative ways, such as AI chatbots, for example, or the kinds of alerts that we are getting on our mobile phones, etc. There are new sort of devices that are coming up. So for example, again in Tanzania, we have a startup called uh, Daktari Kiosk that sort of focuses it has this kiosk like technology that can be placed anywhere in the country, and that can be used to do some preliminary testing for blood pressure and weight and BMI and all of that, and give you some digital results as far as someone's health status, at least from a NCD perspective, is concerned. So we have a lot of these different ways of detecting and tracking our disease conditions, especially when it comes to NCDs. We have mobile phones that can track. We have all these gadgets, Fitbits and all of that that are helping us to understand or track people better. I think that is very exciting, especially when it comes to the NCD perspective that we don't really, talk about enough. So that is definitely one area that I think is quite exciting for me. Secondly, is in terms of patient support system. So now, for example, being a pharmacist myself, I know one of the challenges in the past has always been medication adherence, right? Especially when you're going through chronic diseases. Again, now by use of different technologies, we have mobile apps that can remind people on how to use their medication, when to use them. We have again devices that can be used to do that. We have chatbots that can also do that, and a lot of sort of work going into that. There's ways to support patients. So when you talk about mental health, for example, again there are a lot of different startups that are creating like again either chatbots or like those avatars that can have conversations with you and help you sort of go through some of your mental health related challenges. And so that I think from a you know patient support system perspective, I think is quite exciting. We do have, again, newer technologies such as drones, for example, that are used for, supplying medicines, etc. We are having growth in terms of renewable energy that can help, power health facilities even in remote areas without supply of electricity. We have a lot of different ways of providing education to people. So there's a lot that's happening out there that's very promising. But I do think, whenever we are talking about, or at least whenever I'm talking about digital health, I'm always saying that it can be a double-edged sword as well. Like we need to make sure that we are bringing everyone along, that we are really working on that awareness piece across our communities, because otherwise it will end up increasing inequality rather than improving situations. So we have to be mindful about it. There is a lot of potential, but we need to make sure that we are bringing everyone along.
Thank you so much. So what you're talking about remind me of a study that we want to do. I think I may have to continue. I may have to speak to you about it after this recording. Is we're trying to do some SWOT analysis, trying to look at the current tech startups innovations that are currently in Africa. So I want to look at their strengths, their weaknesses, and just trying to do a report. So that may be one of the things that will complete together. But yes, as someone who has been involved in health programming for a long time, how would you, I mean, what would be your advice to founders and people working in various positions in healthcare, even anywhere in healthcare now, managing solutions, managing innovations? How would you advise them to monitor and evaluate whatever they are working on? What should be at the back of their mind when they are designing, when they are developing metrics, so that they can say, okay, yes, I'm working on an app, I'm working on this, I'm working on that. This should be at the back of my mind when I'm setting up my milestone and timeline.
Gabriel, monitoring and evaluation definitely extremely important, right? Especially in today's, I think, we are seeing globally, I think resources for the health sector are becoming fewer and fewer, and there's a whole conversation around local resources and all of that, and we have to see how that goes. But anticipating that we might be in an environment of restricted sort of resources for the health sector, I think monitoring and evaluation becomes extremely important so that we are able to sort of make the right kinds of data informed decisions. However, I think when it comes to innovations, at least what I always talk about is that again, we need to think slightly differently about innovations because you can't, the whole point of doing something innovative is to try something new. And so, in that way, you are sort of anticipating that it might surprise you in certain ways because it is something new and you don't know it. So, there has to be a certain robustness within our sort of monitoring and evaluation frameworks as well, especially if you're thinking about innovations, right? So, I think number one, it's very important for people to understand that this is the nature of innovations, that innovations are meant to try something new that may or may not necessarily work. Of course, again, bringing the caveat that this is the health sector and we need to be very careful because we are dealing with people's lives. It's extremely important for us to put as much care as possible, but then also to understand that with innovations we are there to learn, we are there to sort of try something new. So we cannot have the kind of rigidity that we have with traditional solutions. There has to be some amount of robustness. The second thing is when we are developing different frameworks of monitoring and evaluation, when it comes to innovations, it's very important for us to have the innovators present, so that they can sort of share their thought processes and all of that, and not to miss out the innovators from all of these conversations again, because you need that innovator perspective to help you come up with the right kind of matrices, and not just think about it from a regulatory or from a programmatic point of view. You need to have the innovators in the room as well so that they can tell you their thought process and you can sort of co-create some of these frameworks. And lastly, similar to point number one slightly, but together with the understanding of the nature, we need to have iterative processes of how we do monitoring and evaluation with very strong learning components. I think that now we talk about not just monitoring and evaluation, but monitoring, evaluation, and learning, which helps us then improve our monitoring and evaluation. So with innovations, that becomes extremely important, right? You need to figure out how are you implementing something, learning as quickly as possible, and modifying your processes, modifying your monitoring and evaluation based on your learning as quickly as possible so that the innovation can thrive.
Okay, I think that is so important in every aspect of development of anything and even of a person. You have to be able to you have to improve iteratively, like learn, go again, learn, shoot again, whatever you're working on. So not just on, because I know people in products use that word a lot, like iterative design, or you hear the word iterative design a lot. But I think not just even in designing, in terms of implementing anything, you have to make sure that you just learn and shoot again, learn and shoot again. And I think I was listening to something recently where he said that the more we keep working on something and we keep making mistake and working on it, the earlier we get to where we are going. Because now we know, we know a better way to do things. Having avoided a lot of errors that we've learned over the time. So that is very good. But I mean, lastly now, because I know we'll still get to talk about things, a lot of other things later in the future. But lastly, on this episode, what would be your advice with your words of experience? I mean, I know you're young, but I know you have years of experience behind you. I mean, someone trying to build something or trying to learn something in healthcare, trying to shoot shots, what would be your advice to anyone coming into the health tech, digital tech game in Africa and Tanzania to be specific as well?
Thank you, Gabriel. I mean, I think the first thing that I always say to young innovators is that it's very important to understand the context of where you are and understand your country, understand your ecosystem, understand your health sector, because, innovations are very context specific according to me. Just because something works in another country doesn't mean it will work in yours. Like there could be some minor tweaks and changes, or even major tweaks and changes that you need to make so that something works in your country as well. So it's very important to be context specific and find contextual problems to solve, right? Don't look at another country, which happens in the digital space, right? Like we see a cool startup in another country and we are like, hey, if it's working there, why doesn't it work here? But many a times, if you understand the context, it becomes very easy for you to know why something that works somewhere else may not work for you. And so that becomes definitely point number one. Point number two is to continuously sort of develop a mindset of continuous learning. Because when it comes to, like these digital innovations and all of that, like I mentioned earlier, things are changing so quickly that it's very difficult to sort of, you can't be comfortable. You can't say that I know everything. Every single day, there's a new technology, there's a new update, there's a new software coming out. So you have to adopt sort of the behavior of continuous learning for you to keep updated. And thirdly, I think innovators need to learn more to work collaboratively with each other, with the governments, with the private sector, with associations, with all the different players in the ecosystem. I think sometimes what happens is that innovators get so sort of engrossed in their idea, and they become so passionate about it that they forget to work collaboratively with other people in the space. And I think that is very important, especially when you're talking about sustainability and longevity of your solution. So those three things I would say are extremely important.
Thank you so much. I think that will be all, except if you have any other thing. But I think we've been able to explore. I think you've brought in like an expert view of looking into healthcare solutions. I mean, trying to come up with anything. These are the things we should know, how to monitor, how to reach limited. I mean, how to reach remote settings. Then, as someone trying to build something, what people should learn, the three things they should learn. So I think those are like the key summaries that I can take home for myself. I mean, I have some ideas as well that I'll also explore and try to think about. So thank you so much, Fan, and I mean that was good, and I enjoyed it, and I hope to hear from you. I will send you a message as well based on what I said, and we can continue discussion and see where we can go with the project. Thank you so much.
Sure. Thank you, Gabriel, for having me, and good luck.
Yeah, goodbye.